Ever been ambushed by a sudden severe pain shooting through your jaw? Or maybe a persistent dull ache that just won't let up? Welcome to the world of temporomandibular joint disorders, or TMJ disorders, as they're commonly known. TMJ disorders are a group of complex problems related to the jaw joint and chewing muscles. They're named after the temporomandibular joint, which is the hinge connecting your jaw to the temporal bones of your skull. It's a pretty crucial joint, responsible for all the opening, closing, and sliding movements of your jaw. When something goes wrong with this joint or the muscles around it, it can lead to a TMJ disorder. The causes can be myriad, from grinding or clenching your teeth, to trauma, to even some forms of arthritis. It's a bit of a tricky diagnosis, as these disorders can also cause symptoms elsewhere in the body, like headaches, neck pain, and even migraines. Now, what does a TMJ disorder feel like? The most common symptom is pain in the jaw joint area, but it can also lead to a limited ability to open the mouth wide, jaws that get stuck or lock, and sounds of clicking, popping, or grating when the jaw moves. It can also cause headaches, toothaches, and even hearing problems. But it's not all doom and gloom. There are treatments available for TMJ disorders. These range from medications to help manage the pain, physical therapy, and even dental work. In some severe cases, invasive procedures like arthrocentesis, injections, or arthroscopy might be necessary. Arthrocentesis is a procedure where the fluid collected in the joint is removed with a syringe. Cortisone injections can help reduce inflammation and relieve pain. Arthroscopy is a more specialized procedure where a small tube called a cannula is inserted into the joint space to correct the disorder. So, to recap, TMJ disorders are painful conditions that affect the jaw joint and chewing muscles. They can be caused by myriad factors and can lead to a wide range of symptoms, not just in the jaw area, but elsewhere in the body too. But with the right diagnosis and treatment, they can be managed effectively. Remember, if you're experiencing persistent jaw pain or any of the other symptoms mentioned, don't ignore it. It might just be your body's way of telling you that something's not quite right with your temporomandibular joint. So, listen to your body and seek professional help if needed.
TMJ, or temporomandibular joint dysfunction, is a disorder that affects the hinge connecting your jaw to the temporal bones of your skull. It's quite crucial as it enables jaw movements for talking, chewing, and yawning. Now imagine feeling discomfort or pain while doing these everyday activities. Common symptoms include aching facial pain, difficulty in chewing, or a locking sensation in the joint that restricts jaw movement. It can also lead to a change in how the upper and lower teeth align. Sounds like a handful, doesn't it? TMJ dysfunction can be due to a variety of factors, including arthritis, jaw injury, or even habits like teeth grinding or clenching. It can significantly impact one's daily life, altering eating habits, communication, and overall comfort. Now that you're aware of what TMJ dysfunction is, let's move on to the do's and don'ts of managing this condition. When it comes to managing TMJ dysfunction, there are certain things you should do and others you should avoid. Let's start with the do's. First off, if you're prone to clenching or grinding your teeth, consider wearing a mouth guard at night. This can help protect your teeth and jaw from the wear and tear of these habits. Also, if you're involved in any contact sports, a mouth guard can provide an extra layer of protection. Next, practice good posture. Poor posture can place excess strain on your neck, shoulder, and facial muscles, which can exacerbate TMJ symptoms. So, sit up straight, keep your shoulders back, and avoid craning your neck forward. As for medication, there are several over-the-counter and prescription options that can help ease TMJ symptoms. These include pain relievers, non-steroidal anti-inflammatory drugs, muscle relaxers, and even some antidepressants. However, it's important to remember that some medications can cause teeth grinding or clenching, so it's crucial to discuss these potential side effects with your healthcare provider. Now, let's move on to the don'ts. Avoid using your teeth as tools. This means no tearing off clothing tags, opening packages, or any other non-food-related activities. These habits can put unnecessary strain on your jaw and exacerbate your TMJ symptoms. Chewing on pens, pencils, or other non-food items is another no-no. This is a common nervous habit that can overwork your jaw muscles. The same goes for chewing on ice or excessively chewing gum. Taking big bites of food can also overwork your jaw muscles, so try to take smaller bites instead. And if you're a habitual teeth clencher or grinder, especially during the day, work on breaking this habit. Lastly, try not to sleep on your stomach. This position can place extra pressure on your jaw and make your TMJ symptoms worse. Remember, these do's and don'ts are crucial in managing your TMJ dysfunction. Despite the discomfort, there's good news. TMJ dysfunction can be treated and managed effectively. A wide range of treatment options are available, starting from home care practices such as wearing a mouthguard to prevent teeth clenching and grinding, to over-the-counter pain relievers and anti-inflammatory drugs. Physical therapy, including TMJ exercises and ultrasound therapy, can help stretch and strengthen jaw muscles. In some cases, non-surgical treatments like transcutaneous electrical nerve stimulation, or TENS, can help relax your jaw muscles. For more severe cases, surgical options like arthrocentesis or TMJ arthroscopy might be necessary. These procedures help to alleviate pain and restore the jaw's normal function. It's crucial to consult with the right specialists for your condition. These may include oral surgeons, orthodontists, otolaryngologists, or prosthodontists. So, with the right approach and medical help, TMJ dysfunction can be a thing of the past. There are several types of over-the-counter, OTC, and prescription medications that can ease TMJ symptoms, including pain relievers like acetaminophen, non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, muscle relaxers, particularly helpful for people who clench or grind their teeth, antidepressants, which can change how your body interprets pain. Some medications, including antidepressants, can actually cause bruxism, teeth grinding or clenching. Non-surgical treatment options include mouth guards. Dental appliances like oral splints or mouth guards can place your jaw in a more favorable position or help reduce the effects of grinding and clenching. While you can buy these over the counter, it's best to get a custom mouth guard from a dentist. Physical therapy. This includes TMJ exercises to stretch your jaw and strengthen the muscles around your jaw joints. Trigger point injections. This involves either dry needling or injecting substances like corticosteroids or botulinum toxin into painful muscle knots in your jaw. Ultrasound therapy. This treatment uses sound waves to deliver heat deep into your tissues. It increases blood flow and promotes muscle relaxation. Transcutaneous electrical nerve stimulation, TENS. This method uses low-level electrical currents to relax your jaw muscles. Behavioral changes. This includes things like improving your posture and avoiding chewing on ice. If medications and non-surgical therapies don't work, you might need surgery. Types of TMJ surgery include arthrocentesis. Providers often use this to find out why your jaw joint is sore, but during this procedure, they can also use a needle to remove fluid from your joint and ease your symptoms. TMJ arthroscopy. A surgeon makes a small incision just in front of your ear and inserts a thin tube that has a light and camera. You might hear providers call this keyhole surgery. They can insert surgical instruments through the tube to reshape bone, remove scar tissue, or reposition the disc in your joint. Open joint surgery. When keyhole surgery isn't an option, a surgeon can perform open joint surgery. This requires a long incision so that your surgeon can access your jaw joint directly. Certain habits can make TMD worse, including using your teeth as tools, like tearing off clothing tags. Poor posture. This can place excess pressure on your neck, shoulder, and facial muscles. Chewing on pens, pencils, or other items, a common nervous habit behavior. Chewing on ice or excessively chewing gum, taking big bites of food, this can overwork your jaw muscles. Daytime teeth clenching or grinding, sleeping on your stomach. TMJ specialists include oral surgeons, orthodontists, otolaryngologists, prosthodontists, dentists specializing in dental prostheses and appliances. How long does TMJ dysfunction last? It depends. In some cases, TMD goes away on its own in 1 to 2 weeks, but in severe instances, it can last several months or even years. TMJ disorder can be short-term, acute, or long-term, chronic. Can TMJ disorder be cured? Yes, it's possible to cure TMJ dysfunction with appropriate treatment and management. The prevalence of temporomandibular joint and muscle disorder, TMJD, is between 5% and 12%. Age between 20 and 40 are the most population involved. The prevalence in adult is 3 times as high as in children. Women are more at risk than men. Genetics, behavioral differences, anatomic differences, and hormones may be why TMJ disorder is so complex and more common in women.